Hello, I'm Dr. Stile, and I'd like to thank you for taking a minute to watch this video. I'd like to talk to you a little bit about abdominoplasties, more commonly known as tummy tucks. An abdominoplasty procedure is a very complex procedure. Even though the steps are the same, no two patients will have the same exact procedure. Each procedure has to be custom tailored to fit a particular patient's anatomy. I've had the great fortune in my practice to perform over 2,400 tummy tucks in the last 16 years. This vast experience with this particular procedure has definitely made us the practice of excellence for having this type of surgery. My patients range in weight from 96 pounds to 260 pounds. They're both male and female. Some of them even have issues regarding reconstruction following previous surgeries or trauma. This experience will put you in a very good position if this is a procedure that you're interested in. The likelihood of you having a result that makes you happy is exceptionally high. The chance of having complications is very low. This is all a result of this vast experience that I've had with this one particular procedure. An abdominoplasty by itself, without the addition of lipocontouring, which is often added to this procedure to address fullness in the flanks, takes approximately 90 minutes. That's an hour and a half. The procedure is done here in my surgery center in this building. Our surgery center is licensed both federally and by the state. These joint certifications make us a unique practice because we are one of the only practices that has JACO certification that's exclusively used as a plastic surgery practice. Your anesthesia will be provided by an experienced board-certified anesthesia doctor. A tummy tuck procedure is usually comprised of three parts. We begin by making an incision in the groin crease, something that's well below the average bikini bottom, bikini underwear, or pants top in men. The procedure next involves elevating the skin off of the rectus or the abdominal musculature. What's most important here is restoring the rectus anatomy. Because of pregnancy, massive weight gain, or a combination of these two forces, the rectus muscles are pushed forward and separate. Once a patient loses weight as part of a massive weight loss procedure following either surgery or adhering to a rigid diet and exercise program, or carries a baby to term and has a child, the rectus muscles never come back to where they were anatomically prior to this. As a result, there is a loss of support in the abdominal wall and a resultant rectus diastasis. You'll hear the word diastasis used several ways. You can hear it as rectus diastasis, diastasis recti, or just diastasis. The word diastasis itself just means space. The resultant diastasis gives a patient a loss of support and the appearance of a bowing out of the abdomen. Some patients mistakenly confuse this bowing out with abdominal fat. What it really is a loss of support contributing to this bowing out or full appearance. Once we've elevated the skin off the musculature and isolated the rectus diastasis, we can easily bring these two muscles back together, which restores the support. Repairing the diastasis has the same effect as a corset or a girdle would, but the only difference is this is under the skin and it's permanent. Next, we pull the abdominal skin flap down and remove the excess skin. Now, there are several ways we can address the belly button. In smaller tummy tucks or mini abdominoplasties, and we'll talk about the different types of abdominoplasties also, sometimes the belly button is left in place and there's enough downward pull that a correction can be made that will satisfy a patient. Most times, however, the umbilicus or belly button is actually cut out, the flap is pulled down, and the belly button is brought out through a new opening. Sometimes patients who are smaller will have a counter incision, which heals nicely. A counter incision is a small incision from the original belly button site that heals very nicely, far below the patient's new belly button position and into the groin space or below the pants line. This is discussed with the patient prior to surgery. Now, there are three types of tummy tucks. I describe them as mini, standard, and extended. This has a lot to do with how long the incision is, how much skin will be removed, and how far the incision reaches around the patient's back. Usually with an extended abdominoplasty, a patient is what we call a massive weight loss patient. They've lost a lot of weight and have a lot of redundant skin that actually is almost circumferential. An extended abdominoplasty takes a little bit longer. The recovery time for all of these patients is pretty much the same. Patients go home a short time after surgery, spending several hours in our recovery center. Once they're home, patients are encouraged to be up immediately. We see all of our abdominoplasty patients the next morning for their first dressing change and a wound check. The drains, there are 2 of them, right and left, are removed at 7 and 14 days. These drains do not hurt while they're in. It does not hurt to remove them, and they're very easy to take care of. Even though the thought of having these drains is overwhelming for some patients, they quickly realize that there's not a lot of maintenance involved with caring for these. The drains are important because they remove serum that collects as part of your normal healing after an abdominoplasty. So we see patients at day 7, day 14. At 2 weeks, patients can be back to most of their normal activity, but nothing involving any heavy lifting, exertion, or activation of core muscles. At 4 weeks, patients are released to resistance exercising, but we still want them to minimize their core activities. At 6 weeks, patients are released to do any activities that they want. I want to thank you for taking time to watch this video. I hope it helped you get a better understanding of what an abdominoplasty procedure is. I hope you watch our videos on YouTube or any of our social media platforms so that you can actually watch one of these procedures being performed. We welcome your comments, your emails, and your suggestions. I look forward to seeing you in one of our next videos. Thank you.